Hi everyone, I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about TMJ relief from the comfort of your own home. There are multiple things that you can do or not do easily at home that can help bring relief from pain and even reduce jaw joint noises. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button as I post a new video every Friday made for people who are suffering from TMJ disorders. For those of you who don't know me, I'm a general dentist with a practice in Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. I work here with my mentor, Dr. Arthur L. Parker. Please be sure to check out the links in the description box below if you want to hang out with me on my other social media platforms, particularly Instagram. I like to post lots of useful information, tips, trivia, tidbits for those of you who like to nerd out on TMJ information like I do. So let's get right into it. What can you do from the comfort of your own home to help relieve TMJ symptoms? Let's start with jaw joint noises. For more information on those noises and exactly what they mean and exactly what's happening in the joint, please be sure to check out my video, Jaw Joint Noises Snap, Crackle, Pop, which I've linked above. If you have those noises, there are things that you can do at home that, if done consistently, can help reduce those noises. One exercise that helps reduce the pops and the clicks within the jaw joint is called the 6x6 exercise. Quick side note, pops and clicks are literally the same thing in terms of what's happening inside the jaw joint. For the 6x6 exercise, you want to start with your teeth edge to edge as if you're biting off a thread. This position can be kind of hard to tell just by feel if you're in the right position, so standing in front of a mirror to actually verify that your teeth are edge to edge is a good idea. Once you get to that edge to edge position, you want to open wide and then go back to that edge to edge position 6 times a day. That's why it's called the 6x6. It's easy to remember. Definitely don't do it 7, 8, 9 times a day. You can overdo it and irritate the joint. And remember to keep your teeth edge to edge. That's a very vital part of this exercise. Another thing to keep in mind is that this exercise does not work quickly. It can take several months or even years to help reduce or eliminate jaw joint noises with this method. The next thing you can do to help reduce jaw joint noises is take a supplement called Ligaplex. This supplement maintains connective tissue health and helps to tighten up loose ligaments within the jaw joints. Some jaw joint noises are present due to loose ligaments within the temporomandibular joints. Ligaplex I and II can help tighten up those loose ligaments. Ligaplex I is largely recommended for people whose jaw joint noises are more acute, meaning they've come on more recently. Ligaplex II is for people whose jaw joint noises are more chronic, meaning they've been present for a year or longer. I've linked Ligaplex I and Ligaplex II in the description box below. That's it for jaw joint noises. For myofascial pain, headaches, jaw pain, ear pain, neck pain, there are also things that you can do at home that will help to bring relief. First and foremost, you can do muscle releases or myofascial release on yourself from the comfort of your own home. Myofascial release, this technique, involves applying sustained pressure to tissue in order to increase range of motion and to eliminate or decrease pain. I've made several videos on myofascial release that you can find in my YouTube playlist called TMJ Exercises/Muscle Releases. For this video, I will be reviewing the myofascial releases that have proven most effective for my patients, releasing the lateral pterygoid, releasing the masseter, and releasing the temporalis. Let's start with the lateral pterygoid. This is a muscle that I call the troublemaker because it can refer pain to the head, to the jaw, into the ear, behind the eye, and even to specific teeth. The lateral pterygoid muscle is also a key player in clenching and bruxing activity. To release this muscle on the left side, you'll use your right pinky and vice versa. So you'll take your pinky finger and you'll actually twist your hand so that the nail of this finger faces inside, faces towards your teeth, and the pad of the finger is towards your cheek once you get inside your mouth. You then take your finger, you open your mouth, and you go as far back and as far up as you can. Once you're inside, close your mouth about halfway, and you'll notice that this increases how far back and how far up you can go. It increases access to the lateral pterygoid muscle. Once you're back there and you've reached the right spot, apply sustained pressure for about 10 to 15 seconds. You'll know you've reached the right spot because this typically does not feel great. This does hurt. So apply as much pressure as you can stand. It doesn't feel good, and often people will say it hurts or it hurts so good because they can feel a release. Once you've applied pressure in one spot for 10 to 15 seconds, change the angle of your pinky and go for it again. So you can do this changing the angle 2 or 3 times, and I wouldn't recommend doing this lateral pterygoid release more than 1 to 2 times per day. So I'm going to get my glove on and go ahead and demonstrate that. Ready. So you take your pinky, again you twist your hand so that the nail is facing towards the teeth once you're inside the mouth and the pad is towards your cheek. And then I'm just going to go as far back and up as I can. You'll see that I'll open wide to begin with, and then I'll close about halfway to increase access way back there. So here we go. I hit the spot. Change the angle. Okay. And that's really it. So you can do that on both sides, and I've had multiple people message me saying that this has really helped. Even though it hurts in the moment, it leads to relief later on. Even though it hurts, there's a very good reason to do this. The sustained pressure on that angry muscle and the fascia surrounding it promotes fresh blood flow, fresh oxygen to that area of angry tissue. It promotes lymphatic drainage of proteins, kinases, lactic acid that builds up in angry muscles. This lateral pterygoid release alone can increase the range of motion of the jaw. I've seen it time and again daily in my practice. Let's move on to releasing the masseter muscle. The masseter is the largest and most powerful chewing muscle. To release this muscle effectively, there's one technique that we do from outside the mouth, and then there's one that we do inside the mouth. Basically, what you do is you just take your middle knuckles, which are these guys, and you place them right underneath your cheekbones. And then you run your fingers with inward pressure all the way down to the angle of the mandible. Use as much pressure as you can handle. This muscle is big. It's often overworked, especially if you're watching this video, you're watching it for a reason. So you can do this one multiple times a day, 3 or 4 times each time you do it. And it really helps to relieve any tense or fibrotic areas that build up in the masseter muscle. If you don't want to use your fingers, you can also use this handy dandy Jade Roller, which I have linked below. This Jade Roller is great because it does the exact same thing. You can apply pressure inwards as you support the other side of your head and then go all the way down to the angle of the mandible. The beauty of this Jade Roller is that it can also help prevent sagging skin and wrinkles, and so you can look up other videos on how to do that aspect of it, but it's a handy dandy little instrument to have at your disposal. Now let's go inside the mouth to release the masseter by running perpendicular to the fibers of this muscle. For this release, you'll need your pointer finger and your thumb finger, same hand, same side. So I'll walk you through it before I demonstrate it. So basically, you're going to put a glove on or wash your hands, whatever you'd like to do, and take your pointer finger and go as far back inside as you can. So run along your inner cheek till you hit bone. Once you hit bone, then use your thumb to grab the outside and give it a little pinch. Once you've got a good grasp on that deep masseter, then sustaining that pinch, come slowly forward. Then you go back in and you grab everything a little bit lower at a different level. Give it a little pinch and come all the way forward. And you can do that as many times as you need to, as long as you run the entire length of the masseter. which goes from the cheekbone all the way to the angle of the jaw right here. So let me put my glove on and demonstrate that. So basically, you're going to take your pointer finger and your thumb back. Feels good. So again, the masseter release, the outside and the inside one, you can do multiple times a day, more than I would recommend doing the lateral pterygoid release. The next muscle we're going to release is the temporalis muscle, which is a large fan-shaped muscle and is a key player in clenching and bruxing activity, just like the masseter and the lateral pterygoid. To release this muscle, you can use your middle knuckles, you can use your fingertips, or you can use that Jade Roller. So basically what you're going to do is take your fingertips and start right at the base of that muscle where it starts and go all the way up and back with pressure inwards. And you can do that a few times. It feels really good. And another way to release just the anterior or forward fibers of this muscle is to find the little indentation behind your orbital bone and your cheekbone. So kind of feel your cheekbone, feel your orbital bone, and go just right behind. And same thing on the other side. And just apply inward pressure for 10 to 15 seconds at a time. This is where many of us hold a lot of stress and tension. And this is typically where tension headaches are or begin. So releasing that temporalis muscle can help quite a bit with those tension headaches. Please be sure to watch all my muscle release videos. They're in my YouTube playlist called TMJ Exercises/Muscle Releases. I have literally received feedback from people around the world saying how much these have helped with headaches, jaw pain, and more. So please check them out when you have some time. Let's move on to other things you can do to get TMJ relief from home. So keep in mind that the neck and the jaw are intimately related. If you can release tension in the neck, it can really feed up and affect the jaw. Please be sure to check out my video called Releasing the Sternocleidomastoid. The sternocleidomastoid is a large neck muscle that when dysfunctional can really limit the range of motion of the neck and cause a lot of neck pain, which can feed up and then affect the jaw in a negative way. Another thing that you can do at home is use this massager or the Theragun. I've linked both below. You can use them on your trapezius muscles or gently on the back of your neck. For the Theragun, I would recommend the mini size because it's small enough for these small neck muscles. I want to say very clearly to not use either of these directly on your jaw or your head. These are for the big muscles, the traps, and then the smaller neck muscles if you use them gently. Both can help a lot in loosening up knots or tense areas in the neck, which then feeds up and affects the jaw in a very positive way. Another thing that you can try is this really amazing microwavable neck pillow. This thing has been my savior, especially when I suffered a really bad whiplash in August of 2020. So it's this guy right here. And basically I just pop it in the microwave for about a minute and a half. And then I place it on my neck and it stays warm for quite some time. And it really, really helps loosen things up. I've linked this microwavable neck pillow below, and I think it's one of my best purchases of all time because it's helped me so much. So what I do at home is I do the Releasing the Sternocleidomastoid, so you can find that process in my video on my YouTube channel. Then I do the massager or the Theragun, and then I top it all off with this microwavable neck pillow, and it brings so much neck and jaw relief. I don't have to do it as much anymore as I did when I first suffered my whiplash, but it really got me through several weeks of pain and limited range of motion in my neck. Oftentimes, TMJ disorders are caused by overworked, dysfunctional muscles that get trapped in a chronic pain and spasm cycle. In addition to everything I've already talked about in this video, a good calcium magnesium supplement can help snap the muscles out of this pain and spasm cycle. Magnesium is amazing for muscles and should be taken in a 2-to-1 ratio, 2 calcium to 1 magnesium. The reason is if magnesium is taken long-term over time, it can start to leach the calcium from our bodies. So we have to replace that. Taking this supplement has really been the turning point for many of my patients who've had difficulty resolving the pain caused by dysfunctional muscles. My mentor, Dr. Parker, studied clinical nutrition, and I have linked his favorite calcium magnesium supplement below, so be sure to check that out. We recommend at least 300 milligrams of magnesium per day, and you can go up to 600 milligrams of magnesium as long as it doesn't, 1, soften your stools, and as long as you are, 2, taking double the amount of calcium with it. Be sure to take any supplement on a full stomach as well. For more relief, be sure to kick bad habits. No gum chewing, no pencil or pen chewing. Don't rest your hand against your jaw when you're awake or when you're sleeping, and try to limit your caffeine intake. Try to limit it to 1 to 2 cups of coffee per day or 1 to 2 cups of tea per day. Also be sure to increase good habits. Stay hydrated, drink 8 cups of water a day, meditate, exercise. I'm a huge proponent of yoga. Lastly, if you're having a TMJD flare-up, avoid tough or chewy foods. Watch my video, TMJD to eat or not to eat, to find which foods are TMJD friendly and which ones are not. So that's really it, my friends. I hope you find this video helpful. I truly hope it brings you relief at home. If you like what you heard or you learned something new, be sure to click like below, subscribe to my channel, do all the things. As always, questions and comments are welcome in the comment box below. And remember, my friends, you can never have TMI about TMJ. Thank you.